Welcome to the deep dive. Today we're looking at something huge, China's aging population. I mean, it's a massive challenge.
It really is. Think about this. The number of older folks needing help with just daily life, that's set to more than double by 2050.
Double. And the costs, the care cost per person.
Oh, they're predicted to just explode, like 6 times higher in cities, maybe 11 times higher in rural areas compared to just a few years ago, 2020.
Wow. That's daunting. So what's being done?
Well, the Chinese government saw this coming, and they started piloting a long-term care insurance system, LTCI, back in 2016.
Okay, LTCI. What was the main goal there?
2 big things, really. 1, promote better health for older adults, and 2, crucially, make sure things were fair. Promote health equity.
Right, equity. That's key. So the big question for our deep dive today, based on some new research, is did it work, especially on that equity front?
Exactly. And that's where it gets, well, complicated.
Okay, let's unpack it. Was there good news?
Yes, definitely. The study looked at really good data from the China Health and Retirement Longitudinal Study, Charles, covering 2011 to 2020.
Right, that's a solid data set.
Very solid. And it found that overall, the LTCI did improve the health of the older adults who were covered. So on a basic level, it helped.
Okay, that's a positive, a fundamental win, you could say.
Absolutely.
But I sense a but coming. What about the equity piece?
Yes. This is the surprising part. Despite that overall health improvement, the program was also linked to wider health inequality.
Wider. How so?
It seems the benefits weren't shared equally. The inequality grew mainly in 2 ways. Between different income groups, with wealthier people benefiting more, and between urban and rural areas favoring people in the cities.
Okay, so a program meant to help everyone, maybe even level the playing field, ended up widening the gaps. How does that even happen?
Well, the researchers dug into the how. LTCI works mostly by helping people pay less out of pocket for medical stuff, right?
Makes sense. Reduces the financial barrier.
You'd think. But the study found that this cost reduction only really happens significantly for the high-income folks and the urban residents.
Wait, so for lower-income people or people in rural areas?
The effect on their out-of-pocket costs wasn't statistically significant. It didn't really move the needle for them in the same way.
That seems backwards.
It does. The paper even talks about a possible reversed subsidy. Like, everyone contributes, but if only certain groups can easily access the services the insurance pays for, then the less connected groups might indirectly be subsidizing the care for the more privileged ones.
Wow. Okay, so it's not just about having the insurance card, it's about actually getting the care.
Precisely. That's the next layer. Access to formal care, things like daycare centers, nursing homes, professional home visits, is critical.
Let me guess, access wasn't equal either.
You guessed it. The study found that the LTCI program itself seemed to be linked to widening the gaps in access to this formal care. It basically reinforced the existing advantages. If you were already in a city or had more money, you likely had better access to begin with, and the LTCI system, as implemented, seemed to strengthen that pattern.
So it inadvertently made it harder for the policy to reach the more vulnerable groups effectively because they couldn't access the services the insurance was meant to cover.
That seems to be the mechanism, yeah. It amplified existing inequalities in access.
Okay, let's recap. China's LTCI, definitely a needed step, and it does improve overall health, which is important.
Very important.
But the way it's currently working, it seems to also be making health disparities worse, favoring the wealthy and urban populations.
It's a real paradox. Good intentions, positive overall effects, but this significant unintended consequence regarding equity.
So it leaves us with a big question, doesn't it? And maybe this is something for you, our listeners, to mull over. If you have a large-scale program like this, how do you design it so it truly reaches everyone equitably? How do you ensure it doesn't just cover costs on paper, but actually bridges the gap in accessing real care, especially for the most vulnerable?
What kind of changes, maybe structural changes, are needed to make sure these vital social insurance programs live up to their promise of equity for all? It's a critical question for policymakers everywhere, not just in China.